My name is Aquina Thulare. I am a technical specialist for health economics in the National Health Insurance branch in the National Department of Health. I chaired a plenary session titled Science for Health and Economic Growth, Building Sustainable Domestic Science Ecosystems. The purpose of this session was to highlight the importance of science being central to the improvements in clinical and public health that we have witnessed over the past decades and that are increasingly becoming important to many countries' economic growth, economic resilience, and national security. The session aimed to focus on creating an open and transparent platform for participants to share experiences and share lessons learned, and to also highlight what could contribute to this sustainable science ecosystems. We worked with the World Health Organization and the UNESCO to shape this session, looking at a probable commission for science for health and economic growth that will be co-hosted by the two multilateral organizations to highlight and harness science for health and economic growth. The discussions focused on various areas, namely looking at how G20 countries and non-G20 countries could share experiences and also gain from each other what countries that are successful economically could do to use science for health and economic growth. So we had in the session our two Director Generals, the Director General of Health, Dr. Sandile Buthelezi, and Director General of Department of Science, Technology and Innovation, Dr. Mlungisi Cele, hosting this session and inviting participants to discuss the areas that we wanted to highlight in the session. And so basically, we had speakers from the South African Medical Research Council. We had speakers from the Fiocruz, Professor Carlos Gadela from Brazil, which is the Fiocruz, Professor Farid Abdullah from the South African Medical Research Council, Dr. Matt Harper from the United Kingdom, who is responsible for multilateral and G7, G20 engagements. We had Professor John Atakuba from the Africa Health Economics Association. We had Professor Vis Mio, who is from Thailand. He's the Vice President of the Thailand Science Research and Innovation. And we had Dr. Rachel Chikwamba from the Council for Scientific and Industrial Research, the CSIR, here in South Africa. The discussions were very, very rich, and they looked at how science ecosystems could be governed, the governance processes of these science ecosystems, what should be done to get domestic investments into the science ecosystems, what was the role of institutions and academia and philanthropy in ensuring that we have got sustainable science ecosystems that could contribute to health and economic growth. And we also looked at what an institution such as a commission could play in creating a platform for science to advise governments on the areas that countries should be focusing on to use science as a tool for health and economic growth. And we also looked at the role of public and private partnerships in investing in science ecosystems to make sure that countries develop these sustainable science ecosystems. The most important message that this plenary was trying to elucidate and take forth was to ensure that, especially we in the developing world, countries from the global south, come up with stable systems that would ensure that they develop a pipeline of experts that would start designing, developing, and coming up with innovations that would help health and contribute to economic growth, especially in peace times, not during a time where we have got, for example, a pandemic. In that fashion, developing countries could also start developing their own innovations that, for example, could come up with active pharmaceutical ingredients that will help us create our own medicines, our own vaccines, our own therapeutics and diagnostics. This would also make sure that governments put enough money into science that is going to contribute to a healthy population and contribute to economic growth. What would also happen is that we would leverage our institutions, our academic institutions, our universities, our research institutions, to use these as a platform that will help our countries to come up with appropriate innovations that would drive the economies of our countries. And also, lastly, to make sure that the private sector partners with the public sector to research and to contribute to innovations that would help us. Underlying this is that we have seen that even during the COVID pandemic, we did not have the necessary technologies that would enable us to either come up with diagnostics, personal protection equipment, vaccines, and other therapeutics, because we do not have a very, very healthy science ecosystem for health and for economic growth. We have seen that in countries such as India, for example, they have created a very stable ecosystem and they are leaders in coming up with API. We have seen that countries such as China are leaders in digital economies and artificial intelligence, and we are still lagging behind. And the purpose of the session was to learn from experiences of such countries, how they have advanced. We have also seen that countries such as Thailand, which is at the same level of economic development as ourselves, is moving ahead in coming up with very, very exciting science ecosystems that are addressing their local health challenges, coming up with innovations, genomic sequencing, predictive medicine that is going to help us in future as we have aging populations, as we have smarter ways of diagnosing diseases and making sure that we come with smart solutions for that. And we have seen that in these countries that I have given examples of, their economies are driven by these innovations. India is the pharmacy of the world. China is the world center for artificial intelligence, for digital economies. And we want us, especially in Africa, to also come up with our own innovations that can help us grow the economy of Africa, but also make sure that our populations are kept healthy. But also, lastly, we learned from countries such as Japan and the UK that their government is actively involved in ensuring that, there are advisory panels that advise government on how to target science and make it applicable and beneficial to the health system itself and to the economy. For example, in the UK, we learned that they have a chief scientist for various areas in the health sector that advises the Ministry of Health on the areas that must be focused on to ensure that the science that is being pursued contributes to the health of the population and also contributes to the economy, thus driving economic growth and economic development. So what we got out of this is that there was willingness from many countries to create a collaborative platform where we could coordinate our efforts and help each other and learn from each other on how other countries are advancing. We know that, for example, the Russian Federation had even offered that they are prepared to help, with the training and creating a pipeline of scientists and experts who will plow back into this science ecosystem. We had our own Council for Scientific and Industrial Research demonstrating how they are training scientists for South Africa, but also for beyond South Africa, as far as Senegal's Pasteur Institute. And they are creating a pipeline of scientists that are going to help us improve, on this science that is sustainable and that will contribute to our health and the economy. And so after the deliberations, there was consideration that, through UNESCO and the WHO, there should be a consideration of coming up with a commission. But what would happen is that we would go back and understand what the impact of the reprioritization, for example, of the WHO and the UN system in general would mean for the Commission. But in general, the Commission as an overall platform for coordinating all these efforts and focusing on countries from the global south that need a lot of success as support would be established and would be coordinating our global efforts. Thank you very much.
Thank you.